For most of us, wastewater isn't even an afterthought. After it's used and sent to the sewer, it's served its purpose. But health experts over the past several years have been using scientific technology to use wastewater at water treatment plants to detect viral diseases from the flu to COVID-19. I spoke with Amanda Bidwell, Scientific Program Manager at Wastewater Scan, an organization that monitors wastewater in communities in 40 states for viral outbreaks. How is wastewater used to detect diseases, and what kind of diseases are you detecting in this water?
Yeah, wastewater monitoring is a really cool tool. So, wastewater monitoring is the process of collecting untreated sewage to test for a wide variety of pathogens or viruses that are shed by people when they go to the bathroom. So, when they flush the toilet, when they wash their hands, when they take a shower. So, it provides a good snapshot of community health at a given point in time. So, we're able to take one sample from a wastewater treatment plant and look for, and in our program at Wastewater Scan, up to 16 different viruses to see what is happening on a weekly basis in a community. So that one sample is sent to our lab and processed within 48 hours. So it provides a really quick turnaround time and is able to tell us what is happening. So we monitor for around 16 different pathogens in wastewater, and those include respiratory viruses, so COVID-19, influenza A and B, RSV. We also look at gastrointestinal pathogens, so stomach bug issues like norovirus. And then lastly, we monitor rare or important emerging pathogens. So right now that would include measles, hepatitis A, and bird flu.
With all this data that you guys collect, why is it so important that health officials and public leaders really take this seriously?
Yeah, so wastewater data is picking up an entire community. So one wastewater treatment plant can serve from 10,000 people all the way up to 4 million, 5 million people. So it provides a community snapshot of what is happening. Everybody is contributing into that system, regardless of test-seeking behavior. So someone may be sick, but they may not go to the doctor. So you're not getting that clinical information on cases. It doesn't require you to seek out or have access to healthcare.
Now, how can this actually be used to be somewhat of an early warning system for a potential outbreak in a community?
Yeah, so most people, when they are starting to get sick, maybe before they start to show signs, whether it be a runny nose or a scratchy throat, they are shedding that virus. Sometimes days, sometimes weeks before they would start to seek out healthcare or feel sick. So we have a signal that may happen several weeks before we start to see things show up in clinical case data. So for public health, they're able to look at the wastewater monitoring dashboard. So that is data.wastewaterscan.org to see what is happening in their community. And it provides that leading edge. So say they need to start making preparations in a healthcare setting to prep for an incoming surge of patients or cases, they're able to plan accordingly looking at the wastewater data.